Greetings. This is Stella and Song and Madame Jennifer Apoa. We are from Penn Dynamic Care at Home. We are the group of people known as the Hospital Readmission Prevention Team. Yes, we have a program like that. We have a team of professionals, nurses, elder care consultants, and geriatric wellness aides, and we have a hospital readmission prevention program. We get asked about it all the time, so we figure we share a little bit of information. So in the state of Pennsylvania, every day, hundreds of patients get discharged home. Hospitals are held accountable, yes, for what happens to these patients right after discharge. The hospitals have to make sure the patients are transferred home safely and that they are discharged with enough information, enough resources, and enough support so that they stay home, they stay well, they recover well, and not get readmitted. There is a critical time from when the patient gets home until the 30 days after. And what we have found is that there is a gap. The patient gets home and the discharge instructions are too complex for them to follow, for the family caregiver. The patient gets home and they are confused about their medications. They have symptoms they cannot manage, and that creates a problem. What we do in the hospital prevention readmission program is we fill in the gaps. So at Penn Dynamic Care at Home, we have this specific geriatric pathway. We use this pathway to prevent patients from getting back into the hospital. So we simplify the discharge instructions. We incorporate the PT and the OT in speech therapy. We incorporate that program into our daily care program. We report symptoms to physicians. We report symptoms to the Medicare team. We educate the patient. We teach them on symptom management because very often it is the symptom management that lands them back into the emergency room and sometimes unnecessary readmissions. So we have this beautiful program. So if you are a doctor's office, you are a rehabilitation center, you are a hospital, this program may be of interest to you. We are not only the experts at it, but we're great at collaborating with these programs and these providers so these patients get to stay home, master their symptoms. Yes, we have a proprietary way of encouraging older adults to do their exercises, to take their medications when they should engage in their own therapy. Because when the patient is informed, when they are engaged, they do not land back in the hospital. It is a program that runs besides Medicare, paid for by either private pay, long-term care insurance, or some families actually use their health savings plan. So if you know a doctor's office, a rehabilitation center, a skilled nursing facility or hospital, a care manager, or a team of professionals caring for older adults interested in keeping their older adults home, keeping complex and chronically ill people from unnecessary hospital admissions, we invite you to give us a call. We will come out, we will provide assessment, we will provide recommendations, regardless of somebody's ability to pay for care. We will do that. And then we help the family and the patient come up with really good, practical, measurable goals so that the patient can thrive, regardless of what is written on their medical record. So those complex patients with pneumonia and CHF and decondition, inability to transfer, neuromuscular degenerative conditions, those complex patients that have that revolving door between home, hospital, rehab, home, we shut that door, we close the gaps, we provide personalized care so these patients can thrive. Physicians love us because not only do we provide the care in a personalized manner, we report the matrix. We tell you how many feet your patient walked today, how much fluid they took in, how much sleep are they getting. We do their pain scale. We educate the family. We educate the family caregivers. We educate the patient. We empower them with such good information that they get better. they stay home, they stay well, they engage in their own programs and do not get readmitted. So we invite you to give us a call today so we can either come out and provide you a mini presentation on how the program works. We'll show you our science-based, science-based, gerontology-based pathway that we use. We will explain it how it works. We can do this also virtually. We do not need to come to your office. But if you need to invite us to your office, we will come. And for some people, they want us to come and bring breakfast or lunch. We'll do that too. We'll come up, we see you, we explain it, we give you resources, we give you free information for your patients so that they can thrive wherever they choose to call home and live well no matter their diagnosis. Thank you for everything you do as a healthcare professional. Thank you for the support you give to the people in our community, and we hope to be of service to you, your team, and the people you serve.